Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
The importance of Breast Cancer Awareness Month is really to bring it into the forefront of what women are thinking about as far as their own health care goes. Because breast cancer is one of the biggest problems women potentially face in their lifetime. And with all of the tools we have for reducing the risk of developing breast cancer, to actually prevent breast cancer as well as screening for early diagnosis, this month I think can empower women with regard to their own breast health. And so what I think we need to do during the month of October is to really let women know what they need to be doing to take the best care of themselves. So the things we focus on there are self-breast exam, which we continue to recommend that women do monthly, to pick a time during the month when they can remember to do it. It's a difficult part of the exam because it often causes a lot of anxiety in women. But we continue to believe it is important, and any findings that are noted they should bring to the attention of their doctor. It is recommended that women have routine screening mammograms, even if they feel perfectly well and healthy, beginning certainly at the age of 50. There continues to be some debate about how often and when to actually start screening mammography, and that's something women should talk over with their primary care physicians. We want women to recognize that what the risk factors for breast cancer are. Clearly, all women over the age of 60 are considered at risk, which is why we recommend they have their routine screening mammograms and see their physicians annually. But there are other risk factors that women need to recognize. Some they can do something about, and some they can't, except to get their regular screening. So the important factors that we recognize for risk of breast cancer is a family history of breast cancer. Any woman that has a first-degree relative of breast cancer, her personal risk is increased. The most important kind of family histories we worry about is when there are multiple family members affected, sisters, mothers, in multiple generations, because that can lead us to consideration that that family may actually be at the greatest risk for breast cancer if they have a gene that is passed down through generations that can dramatically increase risk. Women who begin having their periods at a young age are at increased risk, and women who stop their periods at a late age, late menopause, increases risk. And all of those things we've just talked about are things that are not really much are not under a woman's control. Can't change our family history, our menstrual cycles, etc. But there are a number of things that are under our control. Hormone replacement therapy was prescribed very broadly for several decades until it was recognized that it increases risk of breast cancer. And prescriptions for hormone replacement therapy, routine use of hormone replacement therapy in women who have gone through menopause has plummeted. Incidence of breast cancer has fallen along with the decreased risk of hormone replacement therapy. So any woman who is considering hormone replacement therapy needs to do that with her other risk factors in mind and strongly consider what the benefits and risks of doing that treatment are. So that's something under a woman's control. There are dietary factors that are under a woman's control. Not well publicized but clearly recognized is that alcohol plays a role in breast cancer risk. Does that mean women should abstain completely for alcohol? No, because there are cardiovascular benefits, but it does need to be recognized, and certainly alcohol in moderation is something that would be advised for a woman at risk. Exercise. Lots of studies have suggested that exercise on a regular basis may decrease breast cancer risk. So the importance of those things in talking about them during Breast Cancer Awareness Month is to empower women to improve their breast health. Been very fortunate. I have been a breast cancer medical oncologist for over 25 years, and I have seen dramatic changes in how we treat breast cancer. When I was in medical school, mastectomy was commonplace. Now women can choose to have a mastectomy, but the majority of women have early stage breast cancer and can elect for what we call breast conservation, where the cancerous lump is removed and some additional treatment may be recommended, but that woman can have the same outcome as a woman who has had a mastectomy. Doesn't apply to all patients, but certainly that has become part of the general treatment that we can offer to most women. The other two treatments that we commonly use after surgery for breast cancer are hormone therapy and chemotherapy. And with new tools for DNA analysis on breast cancers, we are actually doing less chemotherapy than we did 20 years ago because we can now identify fairly precisely in certain subgroups of women with breast cancer those women who will benefit as opposed to a whole group of women where only a small proportion benefit. And before we couldn't identify those women, and now we can. So we feel we're giving really appropriate chemotherapy to those women who will benefit the most. Hormone therapy we use commonly because breast cancers are typically hormone responsive, and blocking hormone therapy or blocking hormones can be very effective at lowering the risk of recurrence. We have at least 4 new hormonal therapies for breast cancer that have been on the market, some for a decade or more now, but that didn't exist when I began my training 25 years ago. And similarly, there are now targeted therapies specifically for what is called HER2-neu positive breast cancer. HER2-neu is a gene in every cell of our bodies, and when breast cancers make too much of it, it makes for a more aggressive cancer. And so we have developed, or the pharmaceutical companies developed, a targeted antibody called trastuzumab, which dramatically improves the outcome for women with HER2-positive breast cancer. So lots of progress. In the UMass system, we have multiple sites where breast care is delivered. The majority of breast cancer care takes place at the university campus at UMass Memorial. That's where the Comprehensive Breast Center is located. We have a team of physicians there, including surgical oncologists who specialize in breast cancer, radiation oncologists who specialize in breast cancer, medical oncologists as well. New patients are all seen by a team of physicians on one day and leave the clinic really knowing what their plan of care will be for their newly diagnosed breast cancer. I have also been practicing at Marlborough Hospital, where we are just about to open the new cancer pavilion, where again we have a breast surgeon who practices at Marlborough Hospital. We're about to open a brand new state-of-the-art radiation facility, and then I and others are here seeing patients with breast cancer, so we will be able to render comprehensive breast cancer care in Marlborough and the surrounding community. So we're very excited about the new center.